Good afternoon, everybody. Welcome to the weekly Facebook Live. I'm Justin Westmiller, Director for Homeland Security and Emergency Management. And with us today, we have
Annette Mercatante, Clair County Health Department.
And as always, we're here to answer some of your questions. And first, we're going to go to our slides. Our totals to date, 8,510 total cases with 495 total hospitalized, 242 total deaths with 6,553 total recovered. Changes in the last 7 days, 86 new cases, trying to get me centered here. There we go. 12.3 average new cases per day. So we'll pause there and just note that we are where we were last spring. So we're still relatively high, but obviously not as high as we were in December and January. So that is good news. 279 average tests per day, and we're at 3.0% positive on those tests. And here's our case flow as from the beginning of this event all the way through to where we are now. And as you can see, we've basically reached right around the peak of where we were in the spring with the COVID-19 incident. And this just continues to show our fall off on percent positive in testing, which is a good sign moving forward as long as it continues to do so. And here you have the vaccine doses per week. And we'll talk more about vaccines in the county this week as we continue through the program. And then as always, you can find the dashboard link at stclaircounty.org/offices/health/COVID19.aspx.
So I guess we should just start out with all the questions I'm seeing are all pretty much the same. So we're not going to repeat them all because they're all asking, when will I get my vaccine? I have this condition. I'm this way. I have this. Here's the answer to that. We don't know. We don't know. In fact, this week we have received no vaccine. It is unclear how much vaccine we will receive next week. We've made a commitment, as you know, to provide more than half of whatever vaccine we receive to seniors 65 and older. But with the amount of vaccine allocation we're talking about, that is between 600 and 700 doses per week. And we have over 7,000 people lined up for the 65 and older. So if you do that math and there's absolutely no more people that come in the queue and we don't get any more vaccine than what we are now, that would be 10 weeks. So the answer would be it might be anywhere between now and 10 weeks from now. Although the hope is that we will see more vaccine coming in and we'll be able to vaccinate more people at every given clinic, and that would speed that process up. So that's when, and we can't tell you when you are in the queue. You should know based on what day you signed up, but the system does allow us to strategize based on when a person signs up. It does not have a timestamp yet. So that means if you signed up last Tuesday, you'll be in front of anybody who signed up on Wednesday. I think that's, I guess that's the long and short of that piece.
Yeah, if you guys look down at your Everbridge update, if you guys could go over those talking points, those were a lot of the same questions that people have been asking all week.
Yeah. So, and I'll look at that. I was on another meeting, so I'll have to pull that up. But the one thing I wanted to say is it does timestamp it, but it just doesn't do it to the minute and hour. It only does it to the day right now. We've asked for that to be updated, and we're still working and waiting on getting that update from the provider, from our technical provider. So, but, you know, that group of a couple hundred people that day will still be in front of the people that sign up the next day, just as Doc was stating.
So I do see one comment that says Detroit has a lowered age to 60 plus. Maybe they have a louder voice. Maybe they do, although I can tell you that Justin and I work very hard on the county's behalf to get our vaccine share. What Detroit does have is a much larger population, and they have a much higher social vulnerability index. In fact, the largest in the state, which also trends them towards higher allocations per week. So I don't know that it's as much voice. There are some politics behind what categories are opening up. We have some small counties in the UP that have been able, even with their small allocations, to work through their priority groups because They don't have a lot of people, and now they're moving forward with that. So you're going to start seeing some divergence of what each county is doing. And I've said this before, I don't believe we're ready to move forward with more priority groups because we still have 7,000 plus 65 and older. I'd like to have a plan in place where we could at least see the end of that tunnel a little bit clearer and be more comfortable that we're going to get to everybody, say, within a few weeks. And then I think it's a little more reasonable to open it up to a broader group.
Okay. Let's go over some of these common questions about Everbridge. The first one is there a thank you page now for people who complete the sign up on the website when they finish?
So that answer right now is no, and we're hoping that they get that fixed and get that corrected for us just as soon as possible. And my staff and I continue to work with Everbridge on that.
Okay. The next one was will couples who share a phone or email know which one has an appointment with the notification, including their name?
Yes. So once there's a confirmation message, it will tell you, hi, so and so, whatever the husband's name is or the wife's name. It'll tell you which name was confirmed to get the shot. So you have to accept the appointment, and then it'll come back and confirm to you which person has gotten the appointment.
Okay. The next one was, has the time zone question been fixed to default
Yes.
to our time zone? Yes. Okay.
Yes.
Has the ethnicity question been fixed?
Not yet. So it's still a drop down, I believe, or they're working on making it a drop down menu. And part of the company, the group that works on this is in Texas, and they're obviously in a power outage right now. So we are having some issues getting some of that work done this week because for the last 72 to 96 hours, they have had no power at the Everbridge facility down there in Texas.
By the way, the weather is also why we were not receiving vaccine because this was such a large storm. It impacted the warehouses where the vaccine is being stored. So the shipments didn't get made. So it is another act of God here that has created this lull in our capacity.
More than 30 states were impacted.
I don't know if you answered this or not, but someone had asked that New York and Ohio started vaccinating people with health conditions. Will we get there before May?
I don't know.
Okay.
And so here's the long and short of it. We are going through our vaccine every 7 days prior to getting the next shipment. We are getting through everything the state ships us. That's the only capability we have right now. We are screaming on the highest mountains to give us more, but the state controls the allotment. So we're doing the best we can. It has nothing to do with who's a politician, who's not. It has nothing to do with who's more sick or less sick. It's just the allocation coming to St. Clair County. We want to take care of all of our elderly folks. There's just nothing more we can do right now except for take care of the vaccines that we have and put them in arms.
That's right. And so that makes sense when people have been asking about why I'm on this list, that list, this list, your list, and I'm not getting any calls from anybody. So it's not just a health department problem.
No,
Right.
there's no vaccine
coming into the county.
Okay. All right. Next question. Will the county educators and support staff receiving vaccines through the weekly clinics at the ISD be completed at the end of February as planned? That you had shared this in an earlier news report. Will the end of that
have vaccine available?
Yeah, I think those who we're finishing up. Myers is doing the second doses. We did provide them with the vaccine they needed for that. So I believe that they're kind of. I mean, it's never going to be over. And that people ask, like, well, are we finished with this group? No, because in each category, some people choose to get vaccinated right up front. Some kind of come in a little bit later or change their mind and they want to be vaccinated later. So we're never going to be done with any particular priority group. But I do believe the need to provide that allotted amount of doses has come down. In other words, our next allocation of vaccine will be able to give less to do the schools, the teachers, and we'll be able to provide a little bit more on the side of the 65 and older group. By the way, we still have essential. Yeah, we also have essential workers that are still in the queue that need vaccination. So it's never going to be done. It just, it reaches a point where you can kind of say, all right, there's maybe 300 people left here. We can figure out how to do them. Let's move on.
All right, next question. If the vaccine is good for only 90 days, will we have to go through this process again in June and July?
Well, the vaccine is not only good for 90 days. The 90 days was established because of the limited amount of research, and it was a conservative way of determining how long we could consider a person exempt from exposure after vaccination. Okay, so many of us thought that would be pushed to 180 days because the data is pretty strong at 6 months. It's pretty strong beyond 6 months. We just don't have all the information we need. So the CDC settled on 90 days as a conservative estimate to provide us some guidelines. So that's all that means.
And those guidelines are only until they can finish.
Yeah, they'll change.
Yeah, continuous testing and reviewing those testing so that they can give out different guidelines. Dr. Fauci was on TV just yesterday saying that there's good evidence that these can be good up to 8 months because we've had 8 months of trials. So that those guidelines, like Doc said, will change.
Okay. My mother's 76 and has COPD. Is the vaccine safe for her and still recommended for older COPD patients?
Yes, there's no contraindications based on medical condition. Okay, so if your mother has a condition, any kind of medical condition that they feel warrants protection against COVID, then we recommend them to get it. So all medical conditions can be vaccinated at this point.
Jen, there's a lot of Everbridge talk. I just want to I'm just going to make a blanket statement and then we can move on from Everbridge.
Yep.
So for all of the end user Everbridge issues, just know that they're being dealt with. There were everybody in the country that's using Everbridge is having these same sort of issues. It should not necessarily affect the end users getting of vaccines. So as we continue to get more vaccine, you will get appointments. This will be fine.
That's a good point, Justin.
We've gotten to
we know how to pull those names off. And
yes.
Yeah, we know how to still pull names off. Yeah.
Yeah. Everybody needs to breathe. Let the behind the scenes people work out all the Everbridge things and stop focusing on that. Focus on the things that are important in your life. And, we will get the little technical details figured out. But Everbridge is not something anybody needs to focus on because it's been working great in our county for many years. So just go to sleep tonight knowing that when we have vaccine available, the 7,500 people that are on our list will be in correct order, ready to be provided vaccine when it's available.
Thank you, Justin. The next question that came in yesterday was the last sheet in the weekly update where there's a severity level map. Why are so many local communities still in the red color when vaccine has been available and new cases have been down?
That's a good question. Well, first of all, let's just take the vaccine piece out of this. There's not been enough people vaccinated at this point to impact in any way disease transmission. I think we looked at what are we at, about 7-8% of the total population, and the 65 and older were a little under 20% that we vaccinated. So that is not enough to change the transmission of the virus. So take that piece off. The other situation is that we are providing that map, that heat map, that red coloring to indicate the number of new cases per the population in that zip code. So we have some zip codes that have not a lot of people that live there, and if they have a dozen cases, that puts their rate, the number of new cases that month per the total population, in that higher range, and we calculate that rate. So it's not; those are not based on numbers. of people. Okay, those are based on rates. And the rates, as you can see, are still in the red in many, many places. And that reflects back to what Justin suggested at the beginning, that even though our numbers have come down substantially from the holidays, we still have a fairly solid transmission rate in this community, almost as much as we did back in March when this started. So people do need to remember that, we're not in a place where we can just kind of say, okay, let's not worry about this anymore. We have, for instance, in my community, I live out in Wales Township. There was 13 cases in the past month, but I don't know, there's maybe 5 people that live in that county. I'm kidding. It's not a heavily populated community, and that puts our rate close to 50 people per 10,000, which is red. Not a lot of people, but it's still red. So that has to do with the rates. And if it confuses you, I agree. This is why I've always kind of been pushed back against regional maps, because they're hard to interpret, because there's so much variation on where people live. I hope that answers your question.
Okay, the next question is, if you are in between your first and second vaccine and you get exposed and have to quarantine, how do you go about getting your second vaccine, and how long can you wait to safely receive the second one to be fully immunized?
We do not want people who are in quarantine to come and get vaccinated. So the question is, you don't. If you're in quarantine, you need to wait until your quarantine period is over, which is 10 days or 14 days, depending on the situation, right? So you don't go and get your vaccine until you are out of quarantine.
Okay, thank you. I don't know if you covered this already, but this is on the live feed. When can 64-year-olds with pre-existing conditions get the vaccine? That's in the next priority phase.
Right. Same answer. We don't know. Not now.
All right. This person, if you already have had a mild case of COVID, how long should you wait to get the vaccine? 96 and 94 years old.
Okay. So the response for that is, if you've had a natural infection, all we want you to do is make sure that you are no longer sick. Okay. So that the standard isolation time is 10 days from the onset of symptoms. And then as long as you're not having fevers or symptoms anymore, you can get vaccinated. So it is long. Now, if you're taking a little bit longer to get well, you can wait that extra period. You should be feeling better as well as just being through that isolation time frame of 10 days. But you can get your vaccine as soon as you're feeling better and you're out of isolation.
Okay, thank you. You already answered the one about Detroit. And
can I jump in real quick on that, though?
Oh, go ahead.
Mm-hmm. So,
yep.
There are power players in the state of Michigan, just like there are in every state in the country. Detroit is one, Oakland County, Macomb County, Kent County, Lansing, Ingham County. Those are the 5 power players in the state, period. So you can't base what St. Clair County is doing off of what the city of Detroit's doing. We just don't have the pull that they do, period. It's also why, a lot of the CARES Act money and all the other things go to those 5 destinations, and they don't end up in a lot of other places. So we understand frustration, and here's the end game. By the summertime, you can expect that we won't have a lot of this frustration anymore, because we fully expect to be able to vaccinate thousands of people every day. We are in the lull before the storm right now, and both Doc and I agree on that. This is a deep logistics issue that the entire nation is going through right now. And it's being felt very heavily in small counties like ours, because the numbers are so close together. And that's the biggest issue. Sorry, Jen.
No, that's okay. Thanks, Justin. That's helpful. Somebody wants to know, is it okay to get a mammogram 1 week after my second COVID shot?
Sure. That shouldn't impact any diagnostic testing at all.
Okay. Yeah, a lot of these are still the same questions about the registration system. When will I be vaccinated?
And I'll just go back. I'm looking at some of them too. Just remember that you have the COVID-19 email. So if you're running into glitches and you don't understand, I'm seeing some specific questions here about, get your information and your concerns into that COVID-19 at St. Clair County, stclaircounty.org. And we go through those every day. And if you have a specific need, we'll take care of that for you.
Okay. I have heard that people who have had COVID have had a stronger response to the first dose. Should my parents wait 2 to 3 months before getting vaccinated?
Yeah, I've heard that too. And right now it's anecdotal, but it's a pretty consistent anecdote that the vaccine has a little bit more of the side effect profile if you've already had a natural infection. And I don't have anything more to say to you about that. But these side effects are generally mild and short acting. In other words, within 24 hours, the vast majority of people feel better. And all I would say is that recommendation is to still be vaccinated after a natural infection. If you feel comfortable and confident that you had COVID, you knew you had COVID, you could delay your vaccine for up to 90 days with the assumption that reinfection from COVID is unusual before 90 days. So we're assuming you have that natural protection. Given the shortage of vaccine, I might say that would be kind of a nice thing to do. Wait a little bit longer and let some of the more vulnerable people who've not been infected a little bit closer to the front of the line. But you still can get vaccinated, and that side effect, the local arm tenderness, the fever, and the fatigue, you may feel that a little bit stronger after a natural infection.
Justin, maybe you want to take this one. One
Sure.
person commented, you probably see this, this seems to be an oh well meeting. Many of the Everbridge issues were supposed to be addressed last weekend.
Well, listen, so I don't think any meeting I'm on is ever an oh well meeting, if you know me. I'm a pretty get things done kind of person. We are a little bit at the mercy of the provider here. We signed a contract that says they will provide this, 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 and this. And some of the things we're asking them for are enhancement requests. So they're happy to provide that, but they're working rollouts with many other customers right now. So we're balancing all of our needs versus some off-the-shelf issues and other things. So we're managing all of those issues and getting through it. I think the most important thing is, like Doc and I just said, we will, when we have vaccine in hand, we will be able to pull people off the list, send requests for appointments, and get those appointments scheduled. We have gotten all the kinks worked out from the first week. We are not where we were 3 or 4 weeks ago when the first round went out. So I understand that people were frustrated from 3 or 4 weeks ago, but that's not where we are now. And the issue with not being able to verify if you're registered, if you can re-log into your account, you are registered.
That's a good point.
Thank you. When it opens to more age groups, can it be more for older, like 45 years old to 64, and not 17 years old to 64? Just wondering if that's possible.
That is in discussion. You told me to keep my answers brief.
Yes,
so.
I am. To some of these you've already gone over.
You know, all I can say is that there are pros and cons to every single decision we make like this. So for every decision that has a benefit for one group is going to have a negative impact on another. So these are oftentimes very difficult. And as I've mentioned before, we try, as a health department in St. Clair County, we try to align our process and our guidelines with best practice that are guided through both the CDC and the state. So I don't tend to go rogue, okay, unless I have a really, really good reason to go rogue. And that means that I'll be listening to what my especially fellow county health officers are doing in counties similar to the size of ours, and try and make those decisions accordingly.
Thank you, Doc.
Yeah, it's just a bad idea to go rogue, right? It brings all kinds of extra scrutiny and things that are just it's not good for us. So I agree.
Okay, next question. If there are people who can't make their appointment, are others called to come in quick for vaccination?
Yeah, we don't waste vaccine. We always have a list that we pull out when we know that we're going to have an extra vial or something. So I can't tell you the exact number of vaccines, but I would say the number of vaccines we've had to waste is probably on less than 2 hands. Our staff is very careful about that.
Okay. Justin or Russ, I don't know if you can get this one, but this person said that their husband and her got their first shot on the 10th, and they had set up their appointment for the second shot before they left. They used the same email address, but only got one confirmation with one name misspelled. Is that a problem? Shouldn't her husband have gotten an email too?
It shouldn't be a problem, but if they want to email the COVID-19 inbox, Russ or Rebecca or somebody can look into that and find out. We can dig into the database.
Those are the kinds of things you should send to us directly through that COVID-19, so we can open up
but
the
that's
system.
an easy question. That's an easy issue to work through, not a problem.
And somebody else had said they couldn't log in, told them that their email is incorrect. So again, they should email COVID-19 at stclaircounty.org.
Yeah, please.
They can do that, or they can go through the lost password procedure, and that will help them re-log in.
Okay, thank you. Next question. I had heard concerns about antibody-dependent enhancements or pathogenic priming being associated with previous coronavirus-related vaccines. Are these valid concerns for the new?
Yeah, they're valid concerns. In particular, we've had Can you hear me?
Yep.
Yeah.
Am I frozen? Okay. So yeah, these types of concerns are valid. They have been watched for. They're not a concern with the mRNA vaccine, but they a little bit more so with the viral adenovirus carriers that are coming out. There has been a lot of scrutiny of that, and I think those things are often I don't want to say overly concerned by people, because this is the stuff that the phase 2 and 3 trials absolutely does. It looks for that. And then remember, we have 2 independent advisory bodies that review all the literature, including the ACIP, which specifically is screening for these kinds of concerns. So without getting into the science about what kind of cellular immunity creates and antibodies are created, those concerns are being monitored very closely. And it does not appear at this time that any of the vaccines we currently have approved have that problem. So that's good news.
Somebody mentioned they have an IgA deficiency and they forgot to mention it when they pre-registered. What should they do?
Again, I don't believe there are any medical conditions that are a contraindication to vaccine. If you have a specific concern, you can talk to your doctor about it. But if you mentioned it to us, we would probably just have you wait a little bit longer after you received your vaccine. The issue with deficiencies and things like you're discussing here is that it's not probably very clear, given what was done in the phase 3 trials, whether the vaccine will be fully effective for you or not, right? IgA shouldn't be an issue, quite honestly, but that's the problem with many of these unusual, rare, these kind of chronic medical conditions, is that there's been some testing to feel they're safe, but the actual effectiveness of those might vary from person to person based on their medical condition. It's still, in my opinion, better for you to get it than and accept maybe instead of a 95% efficacy that maybe you're getting an 80% efficacy. It's still going to give you some protection. So I think it's worth it.
So the next question is important. Do the facilities all questions are important, but this one, do the facilities who are holding the clinics have any way to change appointments or give out appointments? Should we be calling the facilities we're at, like the Convention Center, the Washington Life Center?
Yeah, I'll take that. So no, once we get to the clinics, they don't necessarily have a way to change. And the facilities we're holding them at have just been kind enough to let us use their space. So please don't call like the Washington Life Center or the Blue Water Convention Center or any of the schools that we're using or any other facility and try and interact with them as far as vaccines go. The vaccine setup and all of that is
So-
being done at the health department. So,
So
if you
that
need
reminds me, we haven't really done a formal shout out to Scott Crawford and Gino. Gino, I don't know your last name, but these are community leaders that have provided us resources, these facilities. And as you've been there, it's amazing. And I just want to give them a huge thank you for cooperating and working with us so well. It's not been easy what we've been doing. So thank you. Thank you to you guys for helping us out. Oh, we've been out to Yale. Ken Nichols. There's a bunch of people who've provided us locations, and I just want to thank you for that.
Thank you. And also, I'd like to just say thank you to the 211 and also Council on Aging for helping us with the pre-registration process for those who don't have computer access. Okay, how many registered online the first day?
It was like,
Do you
it
remember?
was less than 1,500, I think. It was a good number, but it was just short of 1,500.
And have they been vaccinated yet?
Half of them, maybe?
Yeah, probably half.
We've had at least one good clinic since then, but not after that, unfortunately.
The next person, on your site, do you have weekly updated received first doses? Also, a number of appointments new that you have made? Not sure what they're...
I don't think we list appointments.
Okay.
But we do
Well, we're talking about, so the best place to monitor vaccine administration. So administration mean a person's received the vaccine. Distribution means that that as a county, we've received vaccine. The best place to go is the Michigan COVID/vaccine website. They have a dashboard there that you can go right down to the county level. But like every data collection system, it lags behind, I think, a couple weeks, 2-3 weeks. About a week. Okay, so I just want to warn people that it's not real time. As I've discussed before, real time data is used by us to kind of monitor situations, but it's not reliable data to report out exactly what's happened. You really do need to scrub data like that and make sure that it's reliable before you release it to the public. So these public-facing dashboards will be a couple weeks behind in general.
All right, the next question. I see the variant has been detected in the county now. Are the vaccines going to be effective by the time the general population can be vaccinated? And thank you for all you do for the county.
Thank you as well, and thank you for that. Yes, we do believe that the vaccine is effective against the UK variant, the B117, and that is the only variant that's been identified in the state of Michigan to date. Now, I don't have a crystal ball. I can't predict. There are some variants out there that there are concerns about the effectiveness of the vaccine against them. The South African one, I think, but we don't have those here. We're going to knock on wood. The other thing we don't know about the variant is even though it's more contagious and more easily transmittable, but not more severe as far as creating illness. But even with that, we're not seeing widespread cases in places where that variant's been picked up. So maybe it's not going to really make that much difference as far as new cases. And we still don't know about that. But everything as far as the monoclonals, the treatment, and the vaccine are still good with this particular variant.
Next question. When will the next vaccines be available for the general public again, or the public again?
You mean the mRNA? We don't know. I'd like to say next week, but we received no notification at this time for next week's allocations. None.
Are there any updates on COVID testing?
Well, only that it's still available, and we still encourage everyone to get tested if they've been exposed or feel ill. As you know, you can get tested through your hospital systems, through urgent cares, and we now also have testing available at a testing site we put in Marysville, and that you can get we'd like you to have an appointment for that. 987. Oh, that testing is that testing for the general public?
Yeah.
Okay. Sorry, my bad. So that testing is that testing is available for essential workers, and so that's and for public as well.
Yeah, we're doing it
Okay.
all in Marysville.
Okay. Sorry about that, people. 987-5300. You need an appointment for that, but it is
And
available.
you can also now make an appointment online.
Oh, it's there. Yay.
www.sbchealth.co. It's online now.
Okay.
I'm a co-chair on St. Clair Art Fair to be held at the end of June at this time. Do you think it's a good idea to have it?
That's coming up more and more. What about prom? What about Memorial Day parades? Oh, so here's what I think. I think this virus is going to be with us for a long time. And we're going to have peaks and troughs, and I have no idea when the next peak or trough is going to happen. But the standard strategies to avoid transmission and infection are going to be the same, which means outdoors better than indoors, and close contacts, being close together in a crowd is not good. And so events where you got a lot of people crowding together, even when it's outside, are in my opinion, is not the ideal way to plan events. If you can keep people separated, if you can do things where they have like passports where they can go through an art fair and only a few people at a time. But remember that exposes the artist to multiple people as well. So I think all those things have to be considered. And please why don't you kind of, if you're planning an event like that, why don't you send that through your COVID-19, our COVID-19 email as well. We can maybe have a further discussion about it. You just got to weigh risks and benefits, right? And it's hard to say what kind of position we're going to be in June.
Okay, we're through all the questions.
Really?
Well, this last one, when is it time for municipal essentials? How will health department verify employees? That's the last question.
Work IDs.
Okay.
We'll ask people to bring ID with them.
All right. Well, we can do closing comments now.
Okay, Justin, you go first. I have to think.
Obviously, this has been it's been a trying couple weeks. We started out with some technical issues, and now we're having logistical issues. What I'd like to assure the county on and all of our communities is there's nobody dragging their feet. The whole nation's having these logistical issues, and we will get the vaccines into arms as soon as we get them in our hands within 6 or 7 days. So we are waiting as patiently or impatiently as you are, and we hope to get that done for you as soon as possible. We're also making plans to be able to do large-scale vaccination events just as soon as those sort of numbers come through as well. So like I said earlier, it's potentially the calm before the storm. So everybody hang in there just a little longer and we'll get this done. Have a great week.
Doc, can I just say something before you go?
Sure.
Before you start? For people who joined us, because there's a lot of people who come in late to the show, you can always rewatch this, but we also go back through the show and we timestamp all the different questions, like the categories of questions. So you can also find this on our health department YouTube channel, on our website, etc. So watch for that as well. Okay, thanks, Doc. Go ahead.
Oh, I guess I want to try and be positive here. The longer this goes on, kind of the more tired we get, but it also is building a lot of resiliency, right? We're getting used to living in an uncertain world with a virus that we don't know a lot about. The longer we go, the more we know, the more we get used to this, and the more we realize life is going on with or without COVID. And you can ignore it, but you can't hide. So I appreciate all the work and the questions. And as soon as we can get this vaccine out to you, we will. And thanks for joining us.